What is happening, everybody? Dr. Z here. ZuluTime episode number 150, the Diabetes Secrets series. And today we're going to be talking about Alzheimer's disease and diabetes. What's the link there? We're going to talk about cancer and diabetes. And we're going to be talking about an epidemic that's going on that's called fatty liver disease and diabetes. And what is the connection there in between all those three things? So, the first thing that I want to mention is the connection between Alzheimer's and diabetes. Some experts actually are wanting to call Alzheimer's diabetes type 3, and that's another conversation for another time, but it's just a great example of how linked these two are. Um, Alzheimer's, we know now that is a neurodegenerative disease. So the nerves in the brain start decaying. The little axons around, axons are like the little nerve wires that connect all the brain cells. They start decaying. It's almost like if you've ever seen an old wire. Yes. They start decaying, and so that's what starts happening with Alzheimer's disease. It is the sixth leading cause of death in the United States, and it actually affects the ability of the brain to be able to use glucose properly. And so that's why they say it's almost like insulin resistance, a selective insulin resistance in the brain. And and then the link between Alzheimer's and diabetes is pretty strong. So it seems like there is a link in between the brain not being able to use glucose properly because the insulin is now working. The insulin has resistance. And if just to explain this a little bit better, if you think about the organs in the body as parts of a car, and if you think about the the glucose like the fuel, and then the insulin like the key that allows all these different parts to use the fuel, then in type 2 diabetes the key has been overused, so the key doesn't work anymore. In type 1 diabetes the key is not made by the body, right? And so that's why the link with Alzheimer's disease is such a big link. The second thing we want to talk about today is the how diabetes is linked to cancer. It's pretty big link. So a lot of people who have cancer have diabetes. It's a high percentage of that. And then the people who have diabetes actually have a lower survival rate. So if you compare the people who have diabetes with the people who don't, and then these people get cancer, the people who don't have diabetes survive cancer better than those who do. Um, so those are the things. An interesting thing is that prostate cancer is actually the opposite. So one little interesting nugget there, but for the most part, breast, colorectal cancer, kidney cancer, endometrial cancer, um, if if you have diabetes, you are more likely to have those cancers, and if you do get cancers and you have diabetes, you are at a higher risk of dying from this cancer. So, pretty big, important thing to think about, because if we know that 90% of the people who have diabetes is type 2 diabetes, and if we know that about 80 to 90% of these people could completely overcome diabetes type 2, then and knowing that just having that can increase our chances of having cancer, and if we do get cancer, then our chances of dying from that is a lot higher. Then it's important to take a look at it and see if we can figure out a way to escape type 2 diabetes, so that we're in a better position per se. And then the third thing I wanted to talk about was the non-alcoholic fatty liver disease, which is called NAFLD, non-alcoholic fatty liver disease. So it's called non-alcoholic fatty liver disease because fat or adipose starts accumulating into the liver as uh, triglycerides and exceeding about 5% of the total weight of the liver. And these you can see these when you do ultrasounds of the liver, when you do CT scans of the liver, and a lot of patients come into the hospital with this sort of issues. So when this excess fat causes damage to the liver, then it becomes non-alcoholic steatohepatitis or NASH, and there's a lot of people who have that. About 30, it affects about 30% of the population now. 30% have non-alcoholic fatty liver disease, and is very related to the diet that we're having. Um, and out of the people who have non-alcoholic liver disease, it affects about 30% of the population with diabetes, and then it affects about 5% of the U.S. And so it's a major cause of cirrhosis. And cirrhosis is just when this damage turns into a scar, and then you can't repair it anymore. So you're at the point of no return. And and this non-alcoholic liver disease is a big factor into having people with liver disease that is irreversible. Um, and then by contrast, the people who have non-alcoholic fatty liver disease with type 2 diabetes is about 75%, so pretty high there. And so those are the three main things that I wanted to talk about today. So we talked about Alzheimer's disease and how related it is to diabetes. We talked about cancer and how people who have cancer are more likely to die from the cancer if they have diabetes. And we talked about non-alcoholic fatty liver disease, which is the accumulation of excess fat into the liver as triglycerides. And also we talked about non-alcoholic steatohepatitis, which is NASH, NASH, and this is when the liver gets damaged to a point where it's turning into a scar. And then, and then cirrhosis is the non-reversible damage of the liver itself. So those two things are pretty important. If you have diabetes, know that there is a lot of little tricks and nuggets to be able to manage it. If you have type 1 diabetes, know that you can actually get on top of it and live a really good life even with it. And those of you who have diabetes as an adult, most of the times it's type 2 diabetes, which is completely for about 86% of the people. So out of 100 people, about 86% of the people, it's a completely reversible disease. So you can get away that way, decreases your chances of getting Alzheimer's disease, decreases your chances of getting certain types of cancer, and decreases your chances of getting liver damage. So that's it for today. Until next time, Dr. Z here. I'll see you in the next one. And in the next one, we're going to be talking about why diabetics are more prone to infections, why diabetics have a lot of other skin conditions and skin and nail conditions, and then erectile dysfunction and diabetes. Pretty big issue for men. So until next time, Dr. Z here. Stay well and take it easy. Bye-bye.
Actually, yes. Sunday, right?